whether serving in one of the military treatment facilities across the nation, or while deployed downrange, nurses are often called upon to transfuse blood products to those patients who are critically ill, injured, or unstable. Although this training video will primarily focus on blood administration for inpatient populations, you should be familiar with Medical Group Instruction 44-126 and review it as needed for any questions regarding inpatient or outpatient blood administration. During this training video, we will cover blood requests, the policy and procedures during pre-transfusion, transfusion, and post-transfusion, as well as what to do if there is a transfusion reaction. There are two primary categories of blood requests: type and screen and type and cross. A type and screen is ordered for medical or surgical procedures when blood products are not routinely required, but a need for possible transfusion does exist. A type and screen is only good for 3 days. During that time, should a patient require blood, the type and screen can be converted to a type and cross within 15 minutes. A type and cross is ordered for medical and surgical procedures when blood is likely to be required during or after the procedure. Transfusion services will notify you when the blood product is ready for pickup. After patient verification, the type and screen or a type and cross blood specimen is collected in a lavender top tube, labeled at the bedside, and then hand carried to transfusion services with the properly initiated Standard Form 518. The Standard Form 518 should be marked type and screen or type and cross as appropriate. Now that we've gone over the categories of blood requests, let's take a closer look at the 4 items required prior to transfusing a blood product. They include a doctor's order, informed consent, CHCS lab order, and the Standard Form 518. If a transfusion is required, the doctor will order the blood product in a centris and a type and cross if not previously obtained. The nurse needs to review the doctor's orders in a centris and ensure the order specifically states to transfuse the blood product. If it does not, immediately notify the doctor and have them add this to the order in the comment section. If a patient has not been consented for blood, this must be obtained prior to transfusion. If a patient has been consented, the nurse needs to ensure that it has been completed accurately. The physician is responsible for obtaining consent, which includes educating the patient on the risks and benefits. One area often overlooked on the consent that should be completed in order to have a valid consent is in Section 2. After the patient has read the statement, he or she should have circled the word request and initialed on the appropriate line. Blood consent is valid for the entire length of a patient's admission. The nurse or unit secretary should order the type and cross in CHCS and print a label for the blood specimen. Blood products do not need to be ordered in CHCS. The Standard Form 518 hand-carried to transfusion services with the type and cross will automatically order the blood product required. The nurse also needs to initiate the Standard Form 518 by completing Section 1 for each blood product ordered. Be sure to add any special requests in the remarks block. A copy of the Standard Form 518 can be found in your unit's blood administration binder. Although not required, the Transfusion Checklist Tool, or Keesler Air Force Base Form 770, is a helpful tool to guide the blood administration process. Now that we've discussed the 4 items required prior to a transfusion, let's talk about verification and sample collection. Verification includes having the nurse and second verifier review the order and consent, as well as the Standard Form 518. Then confirm the patient's identity before the blood specimen is collected. Here at Keesler Air Force Base, we utilize the patient's full name, FMP code and social, and date of birth. After the blood specimen has been collected, label it at the bedside. Write your time, date, and initials. The time and date written on the label must match the time and date written on the standard form 518. Remember, the blood sample and standard form 518 are hand carried to the blood bank. Do not tube the blood sample. Transfusion services will notify you when the blood is ready for pickup. While you're waiting on the blood, it's time to prepare the patient. Ensure the patient has a working IV, empty the Foley catheter if applicable, and set up the wide tubing blood administration set with only normal saline. Doctors, nurses, and medical technicians, 5-level or higher, are authorized to pick up blood products. When the blood product is ready for pickup, an authorized person will take the patient's blue card or identification sticker containing the patient's full name, FMP code and social, and date of birth to transfusion services for proper patient verification. The blood bank technician will complete Section 2 of the Standard Form 518. A visual inspection of the unit of blood will be completed by both the blood bank technician and staff member picking up the blood product. The following information must be verified on the Standard Form 518, transfusion tag, and labeled unit of blood: patient's full name, date of birth, FMP code and social, product unit number, blood expiration date, blood type of donor and recipient, and blood compatibility. If all the information has been verified with no discrepancies, then the blood bank technician and staff member will both sign the Standard Form 518 under the Transfusion Data section, Section 3, indicating that the blood product has been properly inspected and is now released for blood administration.
Sir? Good to go. Thank you. You have a go. You do the same.
Now let's review some blood bank rules of engagement. Under no circumstances will blood products for multiple patients be issued to the same staff member at the same time. Transfusion of a single unit of packed red blood cells should not exceed 4 hours from the time it was initially picked up from the blood bank. If a blood product is issued in an approved cooler, that cooler must be returned within 4 hours. If the blood transfusion cannot be started within 20 minutes, return it immediately. If more than 30 minutes has elapsed, the blood product cannot be returned to the blood inventory unless it was initially issued in a cooler. Finally, never store blood products in unit refrigerators and never leave blood products unattended. Now that the patient has been prepared and the blood product picked up, let's review the procedure for pre-transfusion verification. This is the final verification, and it happens at the patient's bedside. The most common cause of a transfusion reaction is a misidentification of either the blood product or the patient. Therefore, positive identification and verification is critical. The following information must be verified with readback on the patient's wristband, Standard Form 518, transfusion tag, and labeled unit of blood: the patient's full name, date of birth, FMP code and social, product unit number and expiration date, blood type of donor and recipient, and blood compatibility. If any of the information does not match, for the safety of the patient, do not infuse the blood component. Notify transfusion services and return it to them immediately. A patient safety report will also need to be accomplished, as this would be a near miss. However, if there are no discrepancies noted, then the first verifier will sign the pre-transfusion data in Section 3 on the Standard Form 518. The second verifier will also sign the Standard Form 518 below the first verifier. After verification, a set of baseline vitals are taken and recorded in Section 3 of the Standard Form 518 and on the blood administration data record. The blood administration data record provides a place for the nurse and tech to record all the vital signs of the patient during the transfusion. Just prior to initiating the transfusion, Provide the patient with some education about what to expect and review the signs and symptoms of a transfusion reaction. Reassure the patient that they will be closely monitored during the entire process. However, he or she should report any of these symptoms immediately.
And I'm going to sit in here with you for the first 15 minutes, and then after that we'll check your vitals periodically. Okay? Do you have any questions?
No, ma'am.
Okay.
Also offer some additional information about transfusions contained in the pamphlet called Circular of Information, found in your unit's blood administration binder. Start the transfusion slowly, no more than 2 milliliters per minute or 120 milliliters per hour. Stay with and monitor the patient for the first 15 minutes because most transfusion reactions will occur during this time. Obtain and document the patient's vital signs on the blood administration data record every 15 minutes times 2, then every 30 minutes times 2, and then every hour until completion. For the safety of the patient, most nurses choose to take vital signs every 5 minutes during that first 15-minute period, but this is optional. If no problems are observed during the first 15 minutes, the infusion rate may be increased to the rate specified by the physician, or to an appropriate rate, ensuring the unit of blood will be completed within the 4-hour window. At the completion of the transfusion, open up the normal saline side of the wide tubing and allow at least 50 milliliters to run through and flush the line. Then the patient's vital signs are obtained and recorded on the Standard Form 518 and blood administration data record. At a minimum, vital signs should be monitored 1 hour post-transfusion. The wide tubing administration set is taken down and discarded in the red biohazard bag. Next, the nurse should complete the Standard Form 518. Then, place the top copy on the patient's chart and return the carbon copy to transfusion services via the tube system within 24 hours. Finally, the nurse should complete the transfusion note in its centris for each unit of blood transfused. If at any time during the transfusion you suspect a reaction, follow these steps. First, immediately stop the transfusion. Second, keep the IV open with normal saline. Third, notify the physician and transfusion services. Fourth, collect 1 red top and 1 purple top from the patient. Label the blood sample with the patient's full name, F&P code and social, date of birth, date and time of collection, the initials of the person collecting, and the words post-reaction. Fifth, collect the first void from the patient. Sixth, return the unit of blood with the administration set intact. Seventh, return the completed Standard Form 518 and complete and return the Air Force Form 1224, which is the blood transfusion reaction investigation. This video was produced in accordance with Medical Group Instruction 44-126. Thanks for watching.